Independence Now. I'm going to get things started. And before we start with our speakers today, I'm going to introduce things, and then we're going to do a quick round from the Centers for Independent Living who are on the call with their vaccine clinic information. We know that's important to everyone. It is being put in the chat. And so if you are able to access that, you can certainly do that. If you're not able to access that, I encourage you to call one of your local centers. Your local one is probably the easiest to get the most local vaccine information, because we are all doing a lot of work on this right now. But so welcome to IAM. This is put together by the Maryland Centers for Independent Living. As I said, I'm Sarah Basehart, and I'm the executive director at Independence Now, which is the Center for Independent Living that serves Montgomery and Prince George's counties. Independence Amplified Maryland, IAM, is pleased to bring you today's program that affects the lives of all Marylanders. Few housekeeping things. This program is recorded and will be archived on Image Center's YouTube channel. A lot of us link to that as well, but you can always find it directly there. It takes about 48 hours for it to show up there because it has to get captioned. So bear with us for a couple of days. I know it's like, earth shattering and you want to come back and watch it again, but give us just a little bit of time to get it captioned and be accessible to everyone. Heather does mute everyone during the presentation of the speakers to avoid all of that background noise. You can unmute yourself, but we are going to ask you to only do that when we're taking questions, because it gets very difficult to hear speakers if others are unmuted during that time. If you have questions, though, please unmute yourself if you need to ask it verbally. You're also welcome to put those questions in our chat, or you can use the raise hand feature, and I'll do my very best to keep an eye on things and make sure we get you called on to ask any questions. And while we're doing vaccine announcements now, if there's any additional announcements, we'll do those at the end of the program. So I'm going to pause here. And let's see, Shannon did our announcement from Independence Now. So we have 3 clinics running here soon. Joan, do you want to announce for ARI?
Sure, I'd love to. Hi, I'm Joan Romanat from Accessible Resources for Independence, and ARI, in partnership with the Howard County Health Department, Maryland Department of Disabilities, and the Maryland Department of Health, is sponsoring a vaccine clinic this coming Friday, the 23rd of April. And if you would like more information, I have put that information in the chat box. You can contact our COVID coordinator, Audrey Sellers, and her number is 443-713-3915. And I just realized I didn't put the email in there. It is covidsupplies@ari.org, and I'll put that in the chat box as well. So if you Howard County residents, if you're interested, give us a call. Thank you.
Thanks. Okay, how about Cheryl Grossman for Baltimore area?
Hi, all. Thank you so much. So we've got a couple of different things in the hopper. For Baltimore City and Baltimore County, for those who live, work, or volunteer in that area, we have about 50 more doses for a clinic partnered between us, the State Equity Task Force, which is peopled by FEMA, and Bikur Cholim, which is one of the Orthodox Jewish organizations in town. At an accessible location, we have 50 more for tomorrow, Tuesday evening between 7 and 9. And that is the final one for our last run of Moderna. Starting again next week, so we have almost a week off. Starting again next week, we're hoping to get the Pfizer product and be able to vaccinate our 16 and 17-year-old folk. This counts for caregivers as well as individuals themselves. So as long as they come with a person who has a disability or chronic health condition needing a vaccine, we can take the others. We don't yet have Pfizer, but hopefully we will. And we are collecting contact information now of those 16 and 17-year-olds to get that done. And then later in May, we do not have dates finalized or locations finalized yet. We are partnering with Baltimore City to do additional clinics at, it looks like, 3 additional locations.
Thank you. And let's see, Dave Dresner from Freedom Center.
Hi, everyone. Freedom Center is collaborating with State Department of Health, State Department of Disabilities, Frederick County Health Department, and community partners, Way Station and the ARC of Frederick County, on a vaccine clinic that will be held Wednesday, a week from this Wednesday, Wednesday, April 28th from 9 to 5 at the Clarion Inn in Frederick, which is at 5400 Holiday Drive. You can call the Freedom Center. I put the info in the chat, or email us at the advocate at Freedom Center email, which is also in the chat, to register or to get more information. We will be posting information about the clinic on our website and our social media, which we have not done yet. The official announcement doesn't actually go out till tomorrow or Wednesday, so you are all getting a first time preview of that. So thank you.
Great. Okay, any other vaccine clinic information from the local CILs? Otherwise, I'm going to get things started the rest of our session. Okay, thank you all. Lots happening. Good opportunities to get your vaccine. So today we're going to have two speakers, Debbie Fairman and Chris Mata, and I'm going to introduce both of them and just to give you a brief overview of how things are going to sort of go down. Debbie's going to kick off with some COVID-related information and then move on to speak about special enrollment opportunity that's happening right now for uninsured folks. And then Chris, who is from the Montgomery County Health Connection, is going to speak about the ways that Marylanders can get help and get insurance and get the financial assistance that they need for that. So let me just tell you who Debbie and Chris are real quick. Debbie is from the Office of Program Operations and Local Engagement with CMS. Debbie joined CMS in September of 2002. She works in the Office of the Regional Administrator on the Regional External Affairs team, where she conducts education and outreach presentations for Medicare and the health insurance marketplace. Debbie also works with the state, federal, and local organizations, developing partnerships and opportunities to bring healthcare information to the public. Debbie is a social worker whose clinical practice is focused on patients with chronic health conditions. And Chris is the program supervisor at the Montgomery County Health Connection. He's been a Maryland Health Benefit Exchange certified navigator since 2017, has previous experience with the Prince George's County Health Connect, and is currently working with the Montgomery County Health Connection. Chris is a certified navigator with Montgomery County since 2019. All right, so Debbie, we're gonna go to you.
Okay, thanks so much, Sarah. I appreciate that. And good afternoon, everyone. I'm usually doing things with people on the East and West Coast, so I was about to say good morning, but this has been a long day, so we'll let the morning go and move into our afternoon. I'm delighted to be here with you. I want to thank Sarah and the Independent SNAL organization for providing this opportunity for us. It is a delight to be with you today. We, and I don't mean to speak for Chris, but I'm sure that his organization as well appreciates the opportunity to share some information that we hope will be beneficial to you, to your community, to the people you serve, families, friends, neighbors, because healthcare, we know, is one thing that affects all of us, right? So, and is particularly during a public health emergency, it is very important to get information, correct information from trustworthy sources. So as Sarah said, I work for the Centers for Medicare and Medicaid Services. This organization is a federal agency. We don't sell insurance. We don't, we're not agents and brokers. Our job is public service, right? So we are here to provide information, help people resolve issues that might impede access or understand what their coverage benefits are. I should distinguish CMS, the Centers for Medicare and Medicaid Services, from the Social Security Administration. The Social Security Administration is a sister agency, and that is the agency that is responsible for determining eligibility and enrollment for Social Security disability, as well as for Medicare. CMS, the agency that I work for, we have oversight for the Medicare program, Medicaid. We work with the states. Of course, the states administer their Medicaid's program, but we work with them in doing so. And also for the marketplace, or otherwise known as the health exchange, and the children's health insurance program. So that's an overview of the agency, but I wanted to distinguish because particularly folks who are eligible for Medicare because of a disability not based on age, it's important to understand that the Social Security Administration makes those determinations and then informs us who those people are. I'm going to get started, and then I'm going to do a little bit about COVID basics that we want to make sure you have an understanding, and then I'll turn it over to Chris, and he'll talk specifically about the Maryland Exchange, so you can make sure that we can make sure that you get that information also. I'm going to shut off my video at this time and share my presentation. Just if somebody could tell me if you can see that. Okay, thanks so much, Sarah. I saw that. Okay. So as I said, I'm with the Centers for Medicare and Medicaid, also known as CMS, and a little bit about what we know about COVID. It is known that this is an infection with SARS-CoV-2, the virus that causes COVID-19. And it can result in a range of illnesses, or some from mild symptoms to more severe illness. And in the most unfortunate circumstances, it can result in death. We don't know how COVID-2 will affect each person individually, but we do know that there are some people who are at increased risk. So some people, like adults 65 years of age and older, and some people with certain medical conditions are more likely to become more severely ill when infected with the virus. And some of those medical conditions that we know are things like diabetes, immune disorders, obesity, cancer, heart disease. So it's important for those individuals to heed some of the precautions that we'll talk about, and also to strongly consider the vaccine that is now available. So there are some actions that everyone can take that can prevent COVID-19. Of course, we talk about wearing a mask that covers both your mouth and your nose, and to avoid close contact with others at least 6 feet, 2 arms length from one another. Avoiding crowds and poorly ventilated spaces, and hopefully as the weather breaks, people will be able to enjoy the outdoors more, but outdoor better ventilation. Washing hands often with soap and water, using alcohol-based hand sanitizers when it's soap and water is not available, and that the hand sanitizer have at least 60% alcohol base. Avoid touching your eyes, nose, and mouth with your unwashed hands. These are passageways that one can ingest the virus. And then clean and disinfect frequently touched surfaces daily. And then consider, of course, getting a COVID vaccine when it is available to you. So COVID-19 vaccines are the way to build a safe way to build protection. Getting the virus itself may offer some natural protection, which is known as immunity, but experts don't know how long that protection lasts. And of course, the risk of severe illness and death from COVID outweighs any benefits that you might get from natural immunity. So COVID-19 vaccinations is thought to be the best protection to offer at this time. And it's actually, I'm delighted to hear so many of you will be offering the vaccine clinics in your community. The vaccines have been administered or provided to the states. And of course, you know, the states make determinations about their rollout plans. It sounds like many of you are already working with your Department of Health in scheduling those. So that is good to hear. So some key facts about COVID-19 vaccinations. Getting vaccinated can help prevent getting some serious sickness with COVID-19. People who have already gotten sick with COVID-19 can still benefit from getting vaccinated. COVID-19 vaccines cannot give you COVID. And this last, this last little thing is COVID-19 vaccines will not cause you to test positive on a COVID viral test. So it could cause a positive test on a antibody test, but not, it would not cause on a COVID test. So let's talk a little bit about payments for COVID testing, because that is, of course, a concern of many. Medicare Part B has added, and the Centers for Medicare and Medicaid Services have authorized the COVID-19 vaccine and its administration to the list of preventive services that are payable under Medicare Part B as in boy. And it is available without copayment or deductible. So typically Medicare Part B does carry some copayments and a deductible. This particular vaccine is not subject to those, so it should be at no cost to the consumer. People with Medicare pay nothing for the vaccine. You won't pay a deductible. You won't pay a copayment. Your provider should not be charging you for an administration fee to give you a shot. Medicare does cover the FDA authorized COVID vaccines as of February 27th. Those authorized or granted emergency authorization for COVID are the Pfizer, Moderna, and Janssen or J&J. There are some people who are in Medicare and are enrolled in Medicare Advantage programs. These are organizations, healthcare organizations like a Cigna or a Humana or a Kaiser or an Aetna, where people get their Medicare A, B, and perhaps their Part D plans, Part D benefits from one organization, and that would be a Medicare Advantage organization. So people that are in Medicare plans pay nothing for the vaccine. They also do not pay copayments. They do not pay deductibles. For the calendar year 2021, those providers will bill original Medicare, and the federal government will pay for the vaccine administration for beneficiaries who are enrolled in a Medicare Advantage plan. So they also pay nothing. No, you know, the copayments and the coinsurance and the deductibles are waived. Through 2021, those plan members, Medicare Advantage plan members, can get a vaccine from any Medicare provider, even if that provider is outside of their Medicare Advantage network. So these Medicare Advantage plans typically have a network, and you see providers that are part of that network. For this plan, this year, 2021, they are able to go outside of their network. So important to know. Medicaid and CHIP must also provide vaccine administration with no cost sharing for most beneficiaries during the public health emergency. However, after the public health emergency, states, depending on the population in their state, the state may reevaluate their policies and amend their plans and submit those for amendment for any updates that they may wish to make. Private insurers, most private insurers cover the vaccine in and out of network at no cost share as well, and for both in-network and out-of-network at no cost share. So at this time, they are following along those lines. And for folks who are currently uninsured, there is the federal government does reimburse providers for uninsured individuals for administering the COVID vaccination to people who don't have insurance. And there is something called the Provider Relief Fund. It is administered by our sister agency in the federal government, Health Resource and Service Administration, otherwise known as HRSA. They run the federally qualified health centers. And they have the authorization for that Provider Relief Fund to reimburse providers for uninsured individuals. So it should not be at any cost to them as well. And I just want to say a quick word. If when a person does get a vaccine, we are hearing some reports, people are contacting saying that they have been charged or they think they may have been charged a fee when they went to their providers. So if individuals get other health services at the time that they get their COVID vaccination, they may owe a copay and a deductible for those other services. They should not be charged for the administration of the vaccination. If they do feel that they were improperly charged, it is important that they check their explanation of benefits, contact their provider to make sure that they have an understanding of how they were billed. If they still feel that they were inappropriately charged for that, and they think that they should not have been, they can report those to the Office of the Inspector General. They can call 1-800-HHS-TIPS, TIPS, or you can visit tips.hhs.gov online. So that kind of information should be reported. Lastly, I will say, the guidance that is being offered out of the CDC, Centers for Disease Control, we leave you with this, and this is the guidance that has been offered, previously, but still bears repeating. Even with the vaccinations, wear a cloth mask over nose and mouth. Those are the outlets where one can emit some spit, that can travel and stay in the area. So you want to make sure you cover both your nose and your mouth. Please stay 6 feet apart or avoid close contact, and to continue washing your hands. I want to draw your attention, since this is a group of organizations that work with both the disabled community and perhaps older adults as well. The CDC created a toolkit. If you haven't had a chance to look at it, I would encourage you to. It has some excellent guidance for people, to help people with disabilities, as well as those who take care of them and serve them, around protecting your health, communicating in your community, and some guidance around equitable vaccine access. So those are available at the CDC website, and on this slide are the links. If you see at the bottom one, if you go to www.cdc.gov/coronavirus, you can actually even put in the search engine toolkit or disabilities, and it will pull up all of the available resources there for vaccine considerations for people with disability, the guidance, and information about equitable access and distribution. So I wanted to make sure that you had that information. And then At this point, I'm going to get ready to turn it over to Chris, who will talk to you about the Maryland exchange. But I do want to say this picture that you see here is the picture that you see on the Federal Health Exchange. So for in January 28th of 2021, there was an announcement about a special enrollment period for people in the marketplace, otherwise known as the health exchange, that allows Americans an opportunity to enroll in healthcare during the pandemic. The special enrollment period is available from February 15th through August 15th. It's available to all residents of the 36 states that use the federal exchange. So there are 36 states that are still using the federal platform that you see here. The remaining states either run their own or they share a platform with the federal. They're state-based, but use some federal exchange. Maryland happens to be a state that runs its own. So we're going to hear from Chris in a little bit about how the Maryland exchange, how you can access it and things that you can learn about it. But this special enrollment period allows both new and current enrollees, so people that are currently getting their health insurance on the exchange, this extra period to go back in and resubmit their application, because there's been an increase in the tax credits that's available to reduce the premium costs. So there is some additional financial help available that helps pay for premiums, and these tax credits are made available through, of course, the American Rescue Plan Act. That does help reduce those premiums. And the changes are made for both calendar year 2021 and 2022. So with that, I'm going to turn it over to Chris, and I'll stop sharing my screen.
Hey, Debbie, it's Sarah. Before Chris starts, so I don't interrupt him, could you repeat the phone number? I didn't get it fast enough when you said the phone number that people could call if they were charged for a COVID vaccine.
Sure. The Inspector General's phone number?
Yes, please.
Okay, let me get that for you. I have it right here.
It wasn't on your slide, so I couldn't.
Yeah, it's 1-800-HHS-TIPS, TIPS. And the website is tips.hhs for Health and Human Services.gov.
Thank you.
You're welcome.
I'm gonna work out what those numbers are in a second. So if you're not good with that, I'll put it in the chat. I have to look at my phone.
Great, thanks. And so I'm going to turn it over to Chris to talk about the Maryland exchange. I just want to point out here on this slide, I've been working in Maryland long enough to know there are people from Virginia and DC that are close enough. They may reside in those areas. DC also is a state-based, and I put on this slide the DC link for residents of the district who might be uninsured or are currently on DC Link and want to be reevaluated to see if their premiums might be lower. So that is also here. And I will come back to this slide. I'll stop sharing so Chris can put his slides up. And we'll come back to that. Thank you.
Thank you so much, Debbie. I'll go ahead and I will share my slides as well, just so we can go ahead and have that on the screen for us to begin. There we go. And if you could just, if anyone could let me know if you're able to see the full slide on the screen.
My computer says you're sharing.
Perfect. Okay, great. Thank you so much. So before I get started, as you can see, what I really will be talking about today is going to be about how to get coverage through the Maryland Health Connection. Before I begin, again, my name is Christopher Mata. I do want to thank Sarah so much for offering us with the opportunity to attend today's I Am session with Independence Now. And I do hope that the information that I provide today will be of use, and it can provide you with information that you may not have known about before, especially during today's current situation. So the main topics that I will be discussing today, just as an overview, I will be speaking about Maryland Health Connection in terms of the financial help we offer, what is covered under the plans and coverage that the exchange offers to Maryland residents, and also about open enrollment and the special enrollment periods that we currently are offering. In addition, I do want to also spend some time specifically to discuss about Montgomery County Health Connection and the different ways that we are here to help during the current COVID-19 pandemic. So in terms of virtual support. All right. So about Maryland Health Connection, many of you are probably familiar with Maryland Health Connection. But there are some new and important updates in light of the COVID-19 public health emergency, and also the recent passing of a new law, otherwise known as the American Rescue Plan Act, that became effective April 1st. So I will share with you all about those new changes that have occurred recently, in addition to some of the basics. So Maryland Health Connection. So we are the state's official health insurance marketplace where Maryland residents can shop, compare, and enroll in private health plans. Our website, marylandhealthconnection.gov, offers enrollments in quality health and dental insurance that fits your needs and budget. And it is the only place in Maryland to get financial help with health coverage. All right, so who is eligible? Now, there are some basic eligibility requirements that one would have to meet in order to be able to take advantage of the assistance that the exchange offers. So to be eligible for health coverage through Maryland Health Connection, applicants do have to be Maryland residents. Also, Maryland residents do have to be either a U.S. citizen, U.S. national, or lawfully present in the United States in order to qualify for assistance, and also not currently incarcerated.
Chris, can we stop 1 second? We have
Yes,
a question.
of course.
Janice, can you go ahead with your question? Miss Janice, can you unmute and ask your question?
Okay, can you hear me now?
Yep, we can.
Okay, well, his voice is breaking up, so I can't understand what it's saying.
Okay, let's see. Chris, maybe we just ask you to move a little closer to your microphone, if that's possible.
Sure.
Or
Is
just
this better?
speak up a little bit. I think you just have a softer voice.
It could be. Is this
Yeah,
better?
that's a little bit better.
Okay. All right.
We do also have captions available. There's usually on the bottom of your screen where it says more, there's 3 dots, and it has show subtitle. That might be helpful as well.
Okay, thank you.
You're welcome.
And Chris, I'll just say no one's ever accused me of that. So, you know.
I'll
Thank
go ahead
you.
and make sure to speak up a little bit more. Just that way I can make sure that everyone is able to hear me a little bit better. All right, so we're gonna be moving on to the next slide. So we have a few different options that is all based off of or depends on a person's eligibility. So Maryland Health Connection, we determine eligibility based off of income and household size. Those are the 2 main factors. So individuals can enroll in either private health insurance with carriers such as Care First, Kaiser Permanente, and United Healthcare with financial help to lower the cost. In addition, individuals can also enroll in free or low-cost coverage through Medicaid or the Maryland Children's Health Insurance Program. And you can enroll in Medicaid at any time of the year if you can qualify. Even if you haven't experienced a life event, Medicaid enrollment is year-round. So expanding on that free or low-cost coverage that the exchange offers, one option is going to be that Medicaid or Maryland Children's Health Program. That coverage is free or low-cost health insurance for those who fall below a certain income range. So just to give you a quick example, for a family of 4 making less than $36,581 a year can qualify for free health coverage. Comparing that with a single individual, the same would go for them if they are making less than $17,785 a year, all depending on whether or not that household or that individual falls below a certain income range. In addition, we also offer the private health insurance plans that work side to side with Medicaid and the Maryland Children's Health Program. So with that private health insurance, there is a very good chance that an individual can qualify for advanced premium tax credits, which will help lower the cost of the health insurance premium each month. And the amount that an individual can save is all going to come down to those same 2 factors, household size and income. Now, due to recent changes that I will discuss in more detail later on in the presentation, as of April 1st, now even more Marylanders are eligible for financial assistance. Aside from the advanced premium tax credits, which lower the cost of the premium, the exchange also offers a cost-sharing reduction. And that is going to specifically target the amount that someone will pay for out-of-pocket costs. So that can include deductibles, co-insurance, and co-payments. One thing to note is that cost-sharing reduction will only apply to silver plans. Silver level plans are going to have that extra assistance built into them. Now, regardless of what plan you select through the exchange, whether it's Medicaid, whether it is a private health insurance, there is a list of essential health benefits that have to be included in every plan offered through the Maryland Health Connection. So that is going to include preventive and wellness care, maternity and newborn care, emergency care, pediatric care, hospitalizations, mental or behavioral health care, prescription drugs, substance use disorder treatments, doctor visits, and lab tests. So regardless of the level of coverage you select with a plan, you are guaranteed that that plan is going to include these main health benefits under that plan. Now, to expand on a specific health benefit that is covered, preventive care. So plans through Maryland Health Connection, they have to cover preventive care regardless if the individual is an adult or a child, without charging a copay or co-insurance. This is true even if you haven't met your deductible. So let's say, for example, an individual does enroll in a lower coverage plan that may have a high yearly deductible. They are still entitled to preventive care without being charged a copay or a co-insurance. One thing to note, however, is that this service is free only when it is delivered by a doctor or other provider in the plan's network. So definitely, I recommend researching the network that your plan works with to make sure that the benefits that you are entitled to are covered at little to no cost. And as a reminder, preventive care, it includes wellness checks like your annual physicals, screenings, vaccinations, etc. All right, so now we're gonna move into part of the presentation where we're gonna talk more about the recent changes that have occurred. So on April 1st, the American Rescue Plan was signed. And as of April 1st, we are offering extra assistance to Maryland residents due to the COVID-19 pandemic. So if you or anyone you know, any family, friends, anyone out in the community who is uninsured, it is definitely worth checking out those health plan options now that there are new savings being offered. In addition, one very important piece of that American Rescue Plan is that if an individual is on unemployment at any time in 2021, regardless if it was only for a week, a month, maybe a few days of the year, they can get a health plan for as low as $1 a month and get extra savings on other healthcare costs. It's one of the biggest pieces that was added to the exchange thanks to the American Rescue Plan Act. In addition, if you didn't qualify for savings before the plan was signed, you can definitely take another look because now there are savings available for higher income individuals and families. So those in the past that weren't eligible based off of their current household size and income, they may now be eligible now that the exchange did increase the income that an individual or a household can earn in order to qualify for assistance. Now, one piece to note, unfortunately, due to the pandemic, many Maryland residents have had experience with Cobra due to loss of employment. Under normal circumstances, Cobra coverage is most times more expensive than what you paid while you were working. And generally, a plan offered through Maryland Health Connection is going to be a more affordable option. But this year, it's going to be a little bit different. So because of the American Rescue Plan Act, effective April 1st, the federal government is providing assistance to those who are enrolled in Cobra. The government will pay 100% of premiums for any Cobra enrollees by paying the health plan directly. This is temporary. It is going to end on September 30th, but for the next 6 months or so, any Cobra enrollees do not have to worry about paying that monthly premium. The federal government will go ahead and pay that directly to the health plan. And if you don't have Cobra, please visit Maryland Health Connection to view plans, prices, and see if you are able to enroll, as coverage may be free or very low cost. All right, so the Cobra deadline in regards to the American Rescue Plan, it started April 1st. So under the plan, the rescue plan, you can enroll in Cobra even if you missed the deadline or decided not to enroll during the 60-day enrollment period. In addition, you can also enroll if you elected Cobra, but later dropped it, if you are still within that original 18-month coverage period. Now, Maryland Health Connection, the exchange, we don't specifically work with Cobra. So if you do have any more questions or need any more information regarding that, we always recommend please contact your former employer for more information regarding Cobra. Now, one very important piece for this year is that the uninsured can enroll in coverage through August 15th, as we are now offering a special enrollment period due to the coronavirus. In the past, in order to enroll in any qualified health plan, you would either have to wait for open enrollment, which was usually November 1st through December 15th. So they only would give you about a month and a half. Or aside from that, you would have to have a special life event occur in order to qualify for a special enrollment period. However, now you are able to enroll at any time through August 15th due to that due to the coronavirus state of emergency. So again, COVID-19 special enrollment period is now through August 15th. Specifically, open enrollment, like I explained before, that's November 1st through the December 15th. Open enrollment is going to be primarily for those who have enrolled in coverage and are looking to renew their coverage or change their existing plan to a different plan effective 2022, January 1st. As I explained before, Medicaid is year-round, so if a consumer is Medicaid eligible, they do not have to worry about qualifying for any special enrollment period. Now, in particular, the special enrollment periods outside of COVID-19 are what we call significant life events, and you would have 60 days from that life event to qualify for these other special enrollment periods. And those life events can be losing job-based coverage, getting married or divorced, moving to Maryland from a different state. For young adults, once they turn 26 and can no longer continue under their parents' plans, that is considered as a special enrollment period as well. And of course, if a consumer is losing their Cobra coverage, they are able to enroll via a special enrollment period. Now, one of the main messages that I did want to share is the different options we have to enroll. Now, due to the COVID-19 pandemic, Montgomery County, we are not offering assistance in person. So all of the assistance that we're currently providing is virtual. So as always, we have our website, marylandhealthconnection.gov, where you're able to enroll in coverage, compare plans, get estimates, general information. It's a very, very useful resource. In addition, we also have the state call center. So for those who do not live in Montgomery County, who live in other counties, but are Maryland residents, please call 1-855-642-8572. That is the state call center. Deaf and hard of hearing can use relay service, and help is available in 200 languages. In addition to the website and the phone number, you can download the free Enroll MHC app to either your phone or your tablet if you are more comfortable, or if you prefer to use a mobile device instead of a computer or a laptop. And as always, navigators, we are available throughout the state to answer questions and help you enroll over the phone. So when you are ready to enroll, there are a few pieces of information that are required in order to apply. We are going to need photo ID, date of births for all family members who are looking to apply, social security numbers or document numbers for legal immigrants, any relevant immigration or citizenship information, employer and income information, and any information that you may have about your current health insurance, which can include job-related coverage for either yourself or anyone in your household who may be eligible. All right, now for this next half of the presentation, I kind of just wanted to focus a little bit more about the different ways that we can help not only you all, but Maryland residents in general. So as you can see, we are basically organized by different connector entities. So I myself, I am representing the Capital North entity, Montgomery County Health Connection, but that does not mean that there aren't other connector entities in the whole state that have their own team of navigators that can provide assistance to you. So these navigators, they work throughout the state. As long as you're a Maryland resident, you can go ahead and take advantage of the services that our navigators provide. And this is just a quick, during one of our Zoom meetings, we took a photo. This is our team. So usually we have a team of about 10 to 12 navigators. So if you are to call our call center, either one of us will be more than happy to provide you with any assistance that you may need. As of right now, most of our support is virtual. So we have adapted to safely provide support from the comfort of your home. So Assistance is provided over the phone. We are available to provide one-on-one support and answer any questions. And of course, online, we can also walk you through the enrollment process if you choose to enroll via marylandhealthconnection.gov. And these are just a few key telephone numbers that I'd like to share. These are going to be specific to Montgomery County. So we do have the Montgomery County Government Call Center. If you need any assistance regarding any type of service or benefits offered by the county. One number I did want to emphasize is the Montgomery County Health Connection Call Center. So that's going to be our 240-777-1815 number. And that number is specifically if you'd like to speak with a Montgomery County navigator. Usually our wait times are a little bit lower compared to the state call center. So if you are having trouble getting through to the 855 number, please feel free to give us a call at our 240 number, and we will be more than glad to assist you. And this will just be general information about the different regions and the different connector entities in the state. We have their phone number and their website for all of the different counties in Maryland. So you'll see we have quite a number of connector entities throughout the state. And lastly, I would just like to thank you all again for the opportunity to be with you all today. Again, I am the program supervisor for Montgomery County Health Connection. That is my email if you ever need to contact me. And I believe that is all for today. The next section or the next slide that we have is the Q&A portion. If there's any questions that anyone has for today.
Did anyone have any questions? There weren't any more in the chat. I did put the phone number for the Maryland Health Connection in the chat as well as the website, but were there any other questions for Chris? That was very thorough and good, Chris. Thank you so much.
Thank you very much.
No? Debbie, did you have anything else to add as we close out, or?
No, I'm just, I wanted to thank everybody for taking time out of their day to spend some time with us. Also, you know, we are very interested in knowing whether or not the information is helpful to you, to those that you serve, the community, and ways that we might be able to improve. So you'll see here, there's a website, a link, cmsgov.force.com/act/evaluation. That'll take you right to a evaluation to give us some feedback about this. But we also, if you have an iPhone, one of these little, you know, if you have your phone and you want to take a symbol of this, it too will take you right to an online evaluation, which is completely anonymous, but will give us feedback on whether or not we are providing helpful information. That is the goal, is to be public servants and to provide you with information that helps you serve your community and helps you in you know, your service. So
Do you want to put that slide up, Debbie, because it's not. Did you have a slide that had that information?
Oh, it's not up. Okay, I'm sorry. Yeah, let me share my screen. I'm sorry, I thought it had it up.
Sorry, Mike, go ahead. Did you have a question?
That's okay. I just had a question for Debbie. I get emails with your name on them a great deal. I don't know how I got on your list, but thank you very much for sending out regular information. How do people get on the Debbie Fairman email list?
I recognize your name, Michael. Actually, you know, if you recall, Sarah shared early on that one of the, in addition to doing, you know, education and providing resources and presentations, developing partnerships with organizations that serve our constituency. And so I work a lot with the state health information and assistance programs, the state departments of health, and any of their little, constituents or other state services. So of course, the disability community, since Medicare does cover the disabled community, we look to ARCs and the SILs and dialysis and any way that we can partner with other organizations that also perform a service for those we serve. So I do a little research and I find out, who are serving the disabled community. That's how I got to Sarah. And she was, most hospitable and in discussing whatever problems she was having with, Medicaid or Medicare. She talked about this meeting and we asked for an opportunity to present because honestly, we don't often, well, now, of course, this past year, we haven't been out a lot, but this is a great way in some ways to meet more people, where I otherwise would be driving around Maryland looking for people to meet. So I'm glad you want to stay on, Michael. Sometimes I get, please take me off this distribution, but I hope you find it helpful.
I do find it very helpful. So thank you very much. And it's nice to meet you. Thank you.
Yeah, thank you so much.
Well, much thank you to Chris and Debbie for presenting today and sharing so much good information. Mike, I'm going to have to bolt out to pick up kids, my new schedule. So if you wouldn't mind fielding any additional,
Sure.
I'm not sure that there are any since we covered all the vaccine clinics that we're hosting, but there may be other announcements people want to make.
All right. Thank you very much, Sarah. And thank you to everyone who listened to the program today. Let's see if there are any community announcements. Anyone has community announcement about your organization and what you're up to these days so that we can make sure that the world knows about them.
Rita from Maryland Relay posted an upcoming webinar, a link to that. I don't know if she's still here and wants to chime in.
Hi everyone, this is Trita. I think you can see me, I'm not sure. But yeah, we have some upcoming webinars. They're open to the general public, so feel free to stop on in. My email address is also in the chat, and it is the simpler version is Tarita, and that's TARITA @mdrelay.org. So feel free if you have questions. I know that you guys also got Kevin's information. He did an amazing presentation a while ago. So you guys are covered.
Tarita, thank you so much. We're glad to get the information out. As you have new events, be sure and let us know.
Sure.
Let me ask, I want to switch subjects a little bit with folks and say that one of the vaccine groups that we're trying to reach out to, and if you have anyone to refer to us, please do so. And that is folks from the behavioral health disability community. Anybody who I think we're going to start doing some specific outreach to those groups, but we aren't getting a lot of feedback from the community, the behavioral health community, about who's getting vaccinated and who isn't. It's possible that a lot of people get vaccinated but don't get tracked, and we understand that. That's fine. That's fine. The system doesn't really track it very well. We just want to make sure we're reaching out to that community. So if you have behavioral health conditions that you want to make and you're trying to fight for a vaccine, we've got some potential for some clinics coming up that might be pointed right at you. So please let us know. Any other announcements for the good of the order? Do we have, by the way, Heather, do we have a show next week, or is that the first week of our open discussion?
No, we do not have a show. Oh, yes, we have a show next week. I'm sorry. We have a show and we have a topic. If you give me 1 second, I will pull up. It's another.
Beginning in May, we're going to do an experiment, just so many of you know. We're going to start doing some shows where we open the floor to general discussion about disability issues. This will be your opportunity to sort of be the show, if you will, but we want to sort of have some discussions with one another. I'm sure I'll come with some topics, but the show is going to be yours. So be thinking about that in May. It's an experiment where we, instead of talking at you or having people talk at you for the whole show, where we let you talk to each other and to the rest of the community. So should be very interesting, a lot of fun, a little scary, but you know, that's life. So we'll be looking forward to having you with us to do that.
Okay. I am pasting that in the chat, and we have Sarah organized this. We have some professionals with expertise in spinal cord injuries on COVID vaccines, and people with spinal cord injuries sharing their personal vaccine stories. So the guests are going to be Dr. Judy Stone, Dr. Suzanne Groa, Dr. Terrence Sheehan, who will answer some questions and give some perspective on the vaccines. Ian Reuter, editor of New Mobility, as well as John Michaels from RFI and Michael Saunders from Independence Now will share their personal experiences as people with spinal cord injuries who've received the vaccine.
All right. And each one of them's going to get 12 seconds?
Maybe.
No. All right. So that I'd be very interesting. I'm glad to hear from that community next week. That's 2 o'clock. Yep.
Somebody has their, I can't, it's like an initial JAUK Ward. I don't know. Has their hand up. Did you want to ask a question or have an announcement to make?
Yes, if I could. It's Joe Awkward.
Yeah, go ahead.
Hey, with Freedom Center. So you did mention, Mike, that you're trying to do a special outreach to the behavioral health community to encourage. So just to clarify that, would you say that's folks that are with disabilities that may lean towards the like behavioral or mental health areas?
Mental health conditions of one kind or another.
Right.
Yeah.
So you just want to have kind of a unique outreach just to make sure that all of us are reaching out to that community. Okay.
So
thank you. I just want to clarify that.
We're just trying to make sure we reach out to that community, let them know about, we have starting in May, we're going to probably have every week 3 or 4 different vaccine clinics around Baltimore and in the region, all the way out into Harford County. And we just want to make sure we're reaching out to that community to let them know to get their opportunity to get vaccinated.
Yes. Thank you.
Yeah, you bet. Freedom.
Hey, Mike.
Hey,
it's Nadine from the Freedom Center.
Hey, Nadine.
I put some information into the chat about our audio book club. We're asking everyone to join us if you have a few minutes. It's every Tuesday at 4 p.m., 4 to 5. We're it's the read the book. Well, not read the book, but we have the book. We listen to the book and then we have a discussion about the book. And right now we're doing Alice Wong's Disability Visibility. So if you have time, join us. The link is right there.
Cool. Excellent. If you're into book clubs, that's the place to be. Is that a book available, on Audible or?
Yes, it is.
All these books are out. All right. Well, I'm an Audible member. I get 3 books from Audible every month. And
we might use you to get some free books.
No, I don't get any free books. Sadly, but I've been an Audible member since before they invented audio recording. It was very lonely there for a while. All right, thank you all very much. Pleasure to have you here. Anyone else have anything for the good of the group today?
Hey, Mike, this is Bong. Can you hear me?
Bong, yes, sir.
Hey, so I think he hopped off because I don't see him anymore. I was gonna kind of throw him in the mix, but I believe he is a new staff member for the Freedom Center. Dave, correct me if I'm wrong, but Chuck.
Yes, Chuck is our new, he is part-time. He is one of our newest ones and he may have jumped off.
Yeah, I think he did.
Yes.
But Mike, what I was going to say is if there's any way that, he could be included in next week's discussion, maybe Dave, you could reach out to him or Nadine. Just in general, his story is
amazing.
Yes.
It's amazing.
Yes.
I've only heard part of it and I'm already in love.
Yeah. See, I know him from the peer mentoring group at Kernan. So
awesome.
It's amazing. So
cool.
And he's excited about his new job. So.
Oh yeah. Yes, he is. He talks about the Freedom Center every Tuesday.
All right.
That's a good thing.
If you work for the Freedom Center and you really like your jobs,
yes,
you should donate funds to the image.
He never said anything bad about
our jobs.
Yeah, he's never said anything bad about Dave.
That's why you should donate money.
Wait a minute, is my video
But,
off?
but you,
Yeah.
hey, Mike,
Yeah.
hey, Mike, you got to
Why?
remember, if you work at the Freedom Center, it's probably because you can't work other places.
Oh.
And it's kind of a donation that you're working there.
Oh, I see.
That's how we pay you. That's right.
That's how we pay.
Yeah, just for the privilege of being there, you know.
The privilege of being there.
Yeah, I asked my boss one time years and years ago, I said, how come I'm not paid what I'm worth? And he said, well, because there's a minimum wage.
That's okay. We love it.
I think Mike told me that
Oh.
one time when I was part of his staff.
Oh, yeah, I probably did. All right. Anything else before we get off of here today, folks? I want to thank you all very much. This is our opportunity to connect to the disability community. We really appreciate everything that you do to make this program work. When you get your announcement about next week's program, there's an opportunity there for you to donate. Please know that those donations are what make all of this possible. We can't do this without you. I know you get a lot of people asking you for money, but there isn't much closer to how you and I progress over the next 5, 10, 20 years than the independent living community. So be a part of it, be a part of us, and please donate when you can. With that, broadcast is done for this week, and we will see you next week at 2 o'clock.